Hello, my name is Sandra Keener, and today I'll be presenting a speech about postpartum mood disorders. This will be my audience for today's video. Have you or a loved one ever experienced a postpartum mood disorder? I know as a mother, I experienced postpartum anxiety and baby blues after the birth of my daughter. As a registered nurse, I have taken care of many women with postpartum mood disorders in the antepartum, intrapartum, and postpartum periods. I believe that education is the way that we will remove stigma and move forward in the treatment of postpartum mood disorders. The first mood disorder I would like to speak about is postpartum anxiety. It is the most common, even more common than the poster child postpartum depression. Postpartum anxiety affects 11 to 21% of all new mothers. However, due to the stigma attached to mental health, less than 50% will receive treatment. We are unsure of why postpartum anxiety manifests, though we have found links to generalized anxiety disorder before pregnancy, leading to postpartum anxiety disorders. We have many treatments available, including selective serotonin reuptake inhibitors, like Zoloft, serotonin norepinephrine reuptake inhibitors, like Lexapro, and benzodiazepines to treat the symptoms of postpartum anxiety. The references for this section belong to the Journal for Nurse Practitioners. Author is Zach. The next mood disorder that I would like to talk about is they're often used interchangeably, and that is incorrect. Baby blues and postpartum depression are two separate mood disorders, though they share many similarities. Most of these similarities come from the symptoms. Symptoms include persistent sadness, low self-esteem, sleep disorders, eating disorders, and difficulty bonding with the newborn child. However, the length and severity of symptoms are what often set these two apart. Baby blues tends to be temporary, resolving within a few weeks. However, postpartum depression often does not. It is more severe and lasts up to a year after the birth of a new child. 50% of these cases also will not receive any kind of treatment due to the stigma surrounding mental health. Treatments include selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and antidepressants. The references for this section belong to the National Library of Medicine, Carlson. The last condition that I would like to speak about is postpartum psychosis. It is important to note that this condition is a psychiatric emergency and does require immediate medical treatment and evaluation. Signs of this condition can vary and are not limited to but include confusion, delusions, paranoia, sleep problems, hallucinations, appetite disturbance, and suicidal or homicidal ideations. This, however, is not a common occurrence. The rate of occurrence for postpartum psychosis is between 0.08 and 2.6 per 1,000 births. Treatments for this condition are still evolving, but typically include antipsychotics, mood stabilizers, and immediate hospitalization if it is deemed that the patient may be a danger to themselves, their newborn child, or others around them. For those with a history of postpartum psychosis, treatment with lithium may prevent another relapse of postpartum psychosis. The references for this section belong to the National Library of Medicine, author Raza. In closing, we have made many strides when it comes to the treatment and understanding of postpartum mood disorders. However, we still desperately need education for both our new mothers and the families that support them. After this presentation, I hope you take away 4 things. These 4 things are: these conditions are common. There is no shame in mental health and needing help for your mental health in any form or fashion. Education is how we will remove the stigma surrounding mental health and these disorders. If you recognize these signs in yourself, your loved ones, or patients, that you will advocate and receive the medical treatment that is needed for these conditions. Thank you for sitting through my presentation. May you have a great day.